everybody, Dawn, Seb from Performance Place Sports Care, and we are locally world famous.
It's true.
It's true. So we're doing a case study today. This one specifically is an older lady who came in with low back pain. She said it happened after she was sitting crisscross applesauce on the floor for hours watching something on her computer.
What was she watching?
She was doing like a meditation video of some sort.
Yep. Okay.
And so she got up and it hurt a little bit, and she gave it a few days to see if it would calm down, and it hasn't. So she came to me asking for some help. And this is how she walked into the front door. I can't at this point remember what direction she was, but let's just say it was this way. She literally came in.
Because she was like looking down a hallway curiously looking at you?
Yeah, right? So she came in like this, and honestly, sometimes this makes us as providers, our lives so much easier. It's like, well, we know exactly what we need to do with this person. But yeah, questions first.
So what do you mean by you know exactly what to do? Because there's probably a lot of people out there who are crooked. It does hurt a lot. I know we're joking, but it is a very serious matter. So what do we usually do? What do we think it is?
So we call this antalgia. So this happens usually because when pain occurs, you're usually trying to get away from the painful spot. So leaning away from it maybe created some relief for her at one point, but it no longer was giving her any sort of relief. It just wasn't getting better. So when you're coming in like this, you can end up just driving your own irritation, creating more compression on one side, opening up and stretching the opposite side. We needed to straighten her back out. She needed to come back to neutral.
Okay. How'd you do that?
We did side glides.
Okay.
So her outcome measure, 1 was just walking. She could feel it with walking. 2, we would just look at her posture and how much more upright she was able to be when she was walking around. And I believe bending forward was another outcome measure for her.
Okay. So bending forward was painful. Mm-hmm. Where was it painful?
It's like it would be like SI joint area. So
that SI joint, was it on the side that she was leaning over?
Away from.
So if it was the SI joint on this side,
mm-hmm.
It hurt to bend forward, and she came in leaning away from it.
Mm-hmm.
Okay.
Yep. So ultimately, Seb, I'm going to have you come over here. You'll be heard.
Okay.
So she was this way, like this, okay?
Where do you want me?
Let's go elbow on that wall right there.
Okay, right.
And so if she, oh wait.
This was this
Let's
side.
put you opposite, because if you're like this, right?
Okay, all right.
There we go.
So just make sure, so since I know we're getting a little mixed up here because the person's not in front of us, let's remind them which side hurts then in this scenario. Is that my side here?
Mm-hmm.
Okay.
Yep. So it's the side away from the wall that was hurting her, okay? So ultimately what we did is I had her take her hand here, and I want you to use the hand to press your hip towards the wall. And at first we want to go really slow, because if she does have pretty high pain levels, this can create a little bit of a pinching sensation or even like a warning signal in your brain. So what we did is I said, just push your hand to the point of a little bit of stiffness and out of it, into it and out of it. And each time she did this, she realized she can get further and further and further until she noticed pain. Eventually there was no pain at all. She could just dip her hip all the way there and back out.
Okay.
So we did this, we did about 3 sets of 10 reps of this. She got up, she walked around, she goes, that feels a lot better. The postural thing came later on in the visit, and even a week later. We had to build up some strength and support for her, but overall her pain levels decreased with just counteracting where her body had put her in the first place.
So I got a question, because I feel like that after doing enough of these videos at this point, we'll get comments of like, hey, I was crooked, I did that, I feel better, thanks. So the side glides, or like the thing that reduce pain, is that all they need to do usually?
Sometimes. It really can be that simple sometimes, most of the time not though. It usually is one of those things that we figure out a way to decrease pain in the beginning, but how do we get this to not be a recurring thing for you? How do we get you back to some more functional things that you've been avoiding due to this pain? So it's not simple side glides and then go run again. We have to build up that support again.
Yeah, that's the thing that like I've noticed with some people, is that there's like pain reduction is obviously really important, but with it's like people have ongoing 20 years of once a year or multiple times a year they have it come back, and they keep doing the same thing and it goes away, but it's not a good way to live, right?
Right.
And I even have friends that stop playing sports because they're like, I don't want to have that back pain again. And so the other things you're talking about are help them get to those other points, right?
Yeah, absolutely.
What else you do?
We did side planks with her too.
Okay.
Yeah.
Let's do side planks.
Okay. So we actually started with just one side. So ultimately, if she was here, I wanted to get her to be stronger on this side to bring, think about it as just bringing you back this way. These muscles can help bring you back to neutral.
So I was leaning that way originally.
So let's recap because I know we got confused. She was here. So we flipped around, went to the wall, did side glides this way. So now I want to get these muscles on this side to help her bring her back to neutral. So for you, it would be right side plank.
So I'm on my right side.
Yes. There we go. And she actually started off from the knees. We couldn't do a full one, and she even needed that extra support with her hand. So do a side plank for me. She just pressed through her knees, came right back up, okay? It was a little bit hard for her in the beginning, more just for strength purposes. So we just did up, down, up, down. And Seb is using the hand in the front of him. Go ahead and flip over and just show them what we're doing. So for her, it was right side, but we're going to show you for camera purposes. She can use this hand to get her to come up and hold for longer periods of time until she became more comfortable. Even just as we went through this, she was like, okay, wait, now I'm feeling better. Hold. Keep that. Can you go fingertips? Can you lift the hand? Then eventually, even towards the end of the visit, she was able to do it without her hand. So we started her here.
Okay, so are we building strength? What are we doing there? Like, what's the point?
I feel like we're building more of a support for her in the spine.
Okay, so I think that's obviously probably a large topic, but one set of exercises done over the course of even a week or a month won't create a lot of strength gains, right?
Yeah.
Okay, so even though she felt better on day one, we didn't build any strength. You're just doing a supportive thing.
Yeah, absolutely.
Okay. What do you think her problem was again? What was her? I think I missed that part. What was her diagnosis?
So for her, it was a disc issue that had been created, and so she was leaning away from side of complaint, but we just needed to get her back. So we just got some joint movement in there. We just got some blood flow to the disc, and it just ended up feeling a little bit better. We found out in the other visit she had some other things going on that we're working on as far as strength too, but this overall at least decreased pain levels, so then we can get her into the strength category to build the more support and more strength as we go forward.
Good. Okay. What do you envision maybe in the future for her, exercise-wise, like for rehab?
So I can't even think of where we are right now. We definitely have her on her feet. She's doing variations of squats. I'd like to get her into some deadlifting at some point. Ultimately, her goal is I want to be able to do exercise videos at home again, is what she was saying. So we're trying to get her to make sure she can do her typical basic movements, maybe with a little bit of weight. She can do them safely, and she can go back to doing that.
Okay. Well, I think that's a good recap. Yeah, so if you guys have a problem like you're a leaner, we rarely find it's the hip flexor. We should probably note that. It's really common to be this disc problem, and they're simple to solve. As Dawn showed us, it doesn't always require medication, surgery, or injections. It can be as simple as some movement-based things that can help. So if you guys have questions or if you want to contact us, there's a link in the description below. You'll just be asked to identify yourself and tell us about yourself a little bit, and then we'll talk from there. We have in-person services, and we also have virtual too. All right. We have all of our free stuff on YouTube here, so you can find any of that free stuff as well as any affiliated free stuff that we have in the link description below. Go to our channel, subscribe, and there's hundreds and hundreds of videos with different things to the body that you can actually check out. So we'll see you guys next time. Subscribe and like.